Hey, aloha gang, Dr.Russ, Rosen here. Welcome to the OHC Community Masterclass. We're going to have to see whether this works or not because I've tried to go live. All right, it does look like it worked this time. Far out. I am now live. Far out. Let me go ahead and check and see if it actually shows up. Not yet. We're going to check and see if it shows up. Let's see. Cool, there it is. You can see that I'm not in my normal place. I'm in my little studio hut in Maui. And that's the background. Okay, so here's the scoop. We're here 3 Tuesdays a month at 1:30 California time, Pacific time. 3 Thursdays a month I do an extra post where I'm giving you other information in here, so I hope you're finding great value. If you don't know me, I'm Dr. Russ Rosen. I help natural healthcare providers like you thrive in a care versus care, true optimal health model. If you find today's program valuable, please let other people know about this community. It's a free community. And if you want to dive deeper into any of these subjects, join the club. I can give you a free month into the club. This Thursday in the club, 11 o'clock, we'll be diving deep into this subject. We spend an entire hour together in a Zoom room where we have a discussion and I help you nail one piece, the best of series. So I hope that you will join us. Again, that's 11 o'clock on Thursday, California time. Of course, if you can't make it, we post it. So here's what I know about us. We really want our patients to get it. We know we have so much to offer. We really want to help them. And if they really understood the value of what you offered, if they really understood what you did, the odds are they would stay, pay, and refer for a lifetime. The challenge is for most of us, that's not true. Our patients don't get it. We get frustrated because they don't get it. They feel better, so they stop. They feel worse, so they stop. Why? Because they don't really understand this concept. Feeling versus function, right? -10 is near death, 0 is comfort. I feel good, but I'm not functioning at my optimum, right? I'm progressively worsening. And then there's me as healthy as I can be. And I know because I've really resolved underlying issues. So there's so much of what we have to offer, but they don't get it. So this whole series that we'll be going through right now, last week we spoke about the neuroscience of communications. Today is the consult. Next week is off. Then we're exam, reported findings, regular daily interaction visits, re-eval, re-reports. Okay, so what I can tell you is for most of us, our patients just don't get the bigger picture. Now, if you look at your retention is number of patient visits divided by number of new patients. Take it over a 3-month period of time, 6-month period of time, whatever. The average out there is 20 visits. Is that enough care over a lifetime? I'm going to suggest the answer to that is not even close. If you're in a true optimal health model, the beginning, the very minimum would be 60, which hardly anybody is there. I have lots of doctors in the hundreds, over 100, over 200. Right? So it's when people get it, they stick around because they value the care. They know they can keep getting more and more value from you. And what I can promise you is the solution is not telling them more. It's not educating them more. It's understanding the neuroscience of communications. So last week we went into that. If you didn't get to see that, go into guides section and then go ahead and go to the last week's one. Excuse me, and you can learn a little bit more about the neuroscience of communications. And again, today we're talking about the doctor's consult. So I asked ChatGPT what would be a great consultation between a doctor, natural healthcare provider, and their patient. What are the crucial things that we need? And I'm always so interested because I love the answers, yet I've never experienced that in seeing a medical doctor or most chiropractors, naturopaths, osteopaths, kahuna. Did I say acupuncturists, massage therapists? I've seen lots and lots of different practitioners over the years, and rarely do these things happen in the consultation. So we want to do a great consultation so we can figure out what's going on and get an accurate diagnosis, come up with an effective care plan or treatment plan for the patient trust and comfort, that they know we know, so they are comfortable with us. It also said holistic care. Look, with a great consultation, you can address not just their immediate issues, but other health issues that they might have going on. They may have neck pain and headaches, but they may also have ADD, sinus problems, brain imbalances, gas, bloating, indigestion, heartburn, coated tongue, stinky armpits, explosive diarrhea. Like, they might have other things also. We might want to look at their lifestyle, right? We might want to take a look at the 3 dimensions of stress that led to these problems and make them make appropriate lifestyle changes. This is our jam. This is what we do. Yet so often our consultation doesn't plant the seeds for that. It doesn't educate them on that process. So again, it doesn't need to take a lot of time. It can be done in 5, 6, 7 minutes. But so much can happen during that period of time if it's by design. Of course, it talked about patient education. We want to be able to educate our patients. And it's all about being able to plant the seeds to educate them without them feeling like they're getting educated, right? Hardly anyone likes to get taught things, but everyone likes to learn, right? So we have to look at ways to help educate them without them feeling like they're getting lectured to, being proselytized to, that they're now in a cult, any of that kind of stuff. Like, get rid of that. And we do it through understanding the neuroscience of communications. Obviously, early detection and prevention, that's our jam. Improved outcomes, reduced errors, all these things. And of course, patient satisfaction. If they get that you get it, if they understand that you understand them, they'll like you more. They'll feel rapport. And by having that relationship, they have a better chance of trusting you and buying from you. So again, well done, chat. I think you did a great job with that. Now the question is, you, the practitioner, are you doing these things? Is this what you're accomplishing? Again, one of the things I always recommend is record yourself. When was the last time you recorded a consult or an exam or a report of findings? It should be regular, as far as I'm concerned. In my one-on-one coaching clients, you're recording, we're listening together. We're being able to point out the blind spots. So the classic blunders that we do is we try to educate them, we try and teach them, we talk at them, we rush them. We let them lead the dance. Now, one of the things will be teaching in the club is how you lead the dance, but they think they're leading. It's a really beautiful little Aikido move. And they think they're leading the dance, and the next thing they know, they're following you, but they don't recognize it. And I'll be teaching exactly how to do that in the club. So another thing we do is we use scripts. We memorize our scripts. Well, remember, they don't know how they're supposed to respond. It feels fake, it feels robotic, it feels plastic. I'm not a big fan of scripts. I'm a big fan of templates. There's a very clear design. I know the questions I'm asking, I know what I'm trying to accomplish, and I have it all done by design. When I do have a wrap down, I want to let you know my main goal is to make sure you're in the right place to get the care you need. My promises, I'm going to help, blah, blah, blah. You do want to write out a perfect one and memorize that. But in my world, there's 3 of those in the consult, exam, and report of findings. 3 little ones you got to memorize that you customize. Other than that, I have a series of questions I'm asking. I know what I'm trying to accomplish it. When I accomplish it, I've planted my seed. I've taught them what I needed to teach them, and we move on. If we do this well, our patients really get it. And it dramatically increases the chances of them stay, pay, and refer for a lifetime. If we do it poorly, the patient can get disinterested, they can get disengaged, they can get angry or frustrated. They might shut down, they might become unresponsive, or even conclude that they're in the wrong place. Let me ask you, have you ever been in a consultation, person seemed just fine, and then all of a sudden their eyes glazed over, or they started drooling, or they crossed their arms and sat back and looked at you questioningly. You caused it. You caused it. And again, neuroscience of communications, we go through how you cause it and what we could do to not cause it. So remember that we're going to be using the neuroscience of communications. The reptilian brain is filtering information. It's all about survival, food, fighting, and fornication. If it's not super important, it's filtering it out. 92 to 98% of all information is not making it past the reptilian brain. In an average conversation, the other person hears about 25% of the conversation. What percent would you like your patients to hear? 100%. That's what we want. And I promise you, using these skill sets, neuroscience of communications, you can do it. And I prove it to you. And I prove it to you in the exam. We'll show you exactly how. You'll be asking them, and you'll see that they got it or they didn't. So the reptilian brain, we need to get the information passed there to the neocortex for what? Thinking, reasoning, and problem solving. If it makes sense, it'll drop in the limbic system as a new belief system. That's where all buying decisions are made. That's where we need to get our information into their limbic system. But remember, we can't do it by trying to educate them, because we were taught by our mothers, fathers, teachers, and preachers to lecture at them, to speak from our neocortex to their neocortex, but it doesn't work. We need to speak from our neocortex to their reptilian brain. Right, so how do you do it? Well, we're going to, number one, make it new, novel, and exciting. How do we do that? Well, we're going to make it about them. As long as you're asking questions about them, they'll be very interested. Number two, we're going to ask Socratic questions. What's a Socratic question? It's a question that makes them think. Why do you think this is going on? Why do you think it's getting better? What level of health do you want to get to? What would you hope for? Blah, blah, blah. Those make them think. When they think, they have to send it past the reptilian brain to the neocortex. Okay? So, and we use stories and metaphors. So what I want to do is I want to show you the 6 things that need to happen during a consultation. In step 1, we need to build rapport. Why do we need to build rapport? Because, and you've heard that before, like obviously, the question is, how do you do that? In our Learning Center, we show you exactly how to do that in 15 seconds or less. But just as an overview, you got to learn how to build rapport. Why? Because if you don't build rapport, when human beings meet each other, we're sniffing each other under the tail and we're looking for friend or foe. If it's foe, you get stuck in the amygdala, fight or flight. If you're in fight or flight, then you're not sending information to the neocortex for thinking, reasoning, and problem solving, and you can't get your information in the limbic system. So you need to learn how to build rapport. If you do build rapport, they'll trust you and buy better chance of buying from you. If they don't trust you, they're not going to listen to you. They're not going to, buy from you. So you got to learn how to build rapport. Again, in our Learning Center, we go into great detail of how to do that. We need to relieve their concerns and fears. My question to you is, does anyone ever come to see you and have anxiety or fear? Absolutely. You're going to hurt me. You're not going to help me. You're going to string me along. Blah, blah, blah. Right? So if they're stuck in their amygdala, you've got to get them out of their amygdala. You have to relieve concerns and fears. Now, the next thing we need to do is find out why they're really here. I get it. Most of you are thinking, well, they're here because of their pain. I can promise you, they're never here because of their pain. They're never here because of their symptom. They're here because of loss or potential fear of loss. That's why they're here. So in the club, we're going to go into great detail. I bet you $1 you've never been taught to do this the way I teach how to do it. And I promise you, if you do it this way, it'll work. It's phenomenal. Everyone I've ever taught this always says, God, I wish I would have learned that in school. I wish I would have learned that 20 years ago. So if you want to jump into the club and see how we do that, just put club below. I'll give you a free month into the club. Okay, so what are they really? Okay, so we're not going to meander. We're not going to take a ton of time. We're going to be throwing darts. We're only hitting bullseyes. We know exactly how to find out why they're here. Okay, quick hit. It's either diagnosis or lack of diagnosis. They're frustrated. They don't know what's going on. They need more information They need to be able to discuss their problem symptom, and it's how it's affecting their life at work, play, and home. We'll be diving deep into that, of exactly how to do that. So we want to do it in a way that they feel that they're in the presence of a master. They're not being interrogated by a technician. So I don't want to be just asking question after question after question. We're having a conversation, heart-led. Okay? So let me just see. Did I say that? Yep. The next thing we need to do, I think it's the fourth thing we need to do, is we need to talk about the 3 dimensions of stress, or in chiropractic, the 3 T's. In essence, mental, emotional, biochemical, physical stress. I need to know about their past and present stressors. How come? Well, the stressors are the things that led to the subluxation, to the lesion, to the congestion of chi. That's what led to it. I mean, it doesn't matter how you practice. It's when we have these stressors and we don't handle those appropriately, our body goes into a defense physiology and we can't handle it. And therefore we start showing signs and symptoms of sickness or disease or pain or whatever it is. So we need to be very clear. We need to get through this very quickly, that they need to be able to understand it's an accumulation of stress over time. No wonder you're in the shape you're in. We need to answer the question in their mind, enter the conversation in their mind, which is, why is this going on? Why am I here right now? If you're a chiropractor and you're talking subluxation, they're thinking, well, I don't remember getting bit by a subluxation dog. So how did I get a subluxation? So I got to enter the conversation in their mind. I then need to help them understand that this is classic. This is classic. Make it personal to them. I don't want to just say, this is classic. You have neck pain and we help people with neck pain, blah, blah, blah. There's nothing new and novel about that. This is classic. Here's how it happened, and this is what you're experiencing. Think about this. Joe, this is classic. You have neck pain and we help people with neck pain. Right? Joe, this is classic. When you were 8 years old, you were in your grandfather's cherry tree. You fell out and hit your head, and since that moment, you've had terrible neck pain that goes right down this arm, exactly like that nerve chart. That keeps your attention. That's new. That's novel. That's exciting. And that's educating them along the way. We're going to educate them through our questions. I'll be showing you exactly how to do that this Thursday in the club. And then the last thing we're going to do is offer hope. I know in the scare model, the last thing you want to do is offer hope. Right now, you want to scare the hell out of them, right? That they have subluxation, and them and their next 5 generations are going to die. In the care model, we're going to empower them. We're going to empower them and offer hope. So we want the healing process to begin right now, and we want to get them in the right frame of mind to begin to heal. So those are the 6 things that need to happen in the consultation. In my world, in the Learning Center, we can also have one of our staff go in and do a pre-consultation. So the doctor's consultation literally is 2 or 3 minutes. But all of this can be done if you're a high volume doctor, 5 minutes. If you're doing, you're talking nutrition and you're talking emotional stress and you're really diving into that kind of stuff and going deeper, which a lot of the doctors that I coach do, then, it could take 8, 9, 10 minutes. In a consult, if you're spending a lot more than that, you either have a very specific nuance, specialty practice, or you're wasting a lot of time. Odds are you're wasting a lot of time. If you've got a great history that they fill out, where they've already filled out most of the stuff that you need to know, and then you know how to set up the frame appropriately, so that they understand how much time we have together, etc. It doesn't take very much time. So if you have any questions and you're there right now, please go ahead and let me know that you're there and where you're from. And I'm going to go ahead and check right now. I gotta get rid of this right here. We've got Dr. Schmidt. Aloha, welcome aboard. Good to see you. Hope to see you in the club this Thursday. Anybody else is there, say aloha. If you have any questions, you're going to let me know right now. If you're watching this on replay, which I know most people do, you have questions, just go ahead and put them below. I respond. Amazingly enough, I actually respond. in detail. Okay, so I hope you found that valuable. If you'd like to be in the club, go ahead or get into the club for a month. And again, you can get these and all kinds of great stuff in the club. I have all of them, of all of the subjects already pre-recorded in there. So a ton of great information you can have. As always, hope you found that valuable. As always, much love and aloha. Bye, gang.